Hi, I'm David Gadd. I'm Professor of Criminology at the University of Manchester, and since 2022 I've been leading a research project called the Making Change Meaningful Project, and that has been an evaluation of the outspoken talking therapy intervention that is offered by the charity We Are Survivors.
Hi, my name's Jess, and since April 2024 I've been working as a researcher on the Making Change Meaningful project, which is an evaluation of the Outspoken Talking Therapy service. So what is Outspoken? Outspoken is a talking therapy service that supports people in prison to break their silence around rape, sexual abuse and sexual exploitation. The service helps people to understand what happened to them wasn't their fault, and helps them to develop skills to cope with their trauma. This also contributes to helping people understand how their trauma may be connected with their offending. One of the best things about Outspoken is how it really focuses on the individual, what they would like to discuss. It goes at your pace in a way that feels right for you.
The Outspoken Talking Therapy service offered by We Are Survivors doesn't assume that clients can come into the therapy room ready to talk about everything that's happened in their past. Rather, the therapist will spend some time, that may be weeks or even months, helping the client sit with their feelings, feel safe in their mind and their body before they begin the task of recollecting what happened to them. The therapist will help the client eventually to try and tell a new story, to build a story of things that have happened in their past, things that may have been confusing or embarrassing or have made them feel ashamed. And when they've done that, they will help them to try to find somebody who they trust, they can begin to come out to and talk about their journey from victim to survivor.
So there are many different reasons why men access the Outspoken service, but our research has found that some of the main reasons are because they may want help in controlling their emotions, they may want help learning how to forgive themselves and understanding that their abuse wasn't their fault. They may want a safe space to explore their past in a supportive environment, or they may want help addressing symptoms of their mental health difficulties like anxiety, depression or PTSD. Or they may be approaching release and want help reconnecting with friends and family. And there are many, many more reasons. The Outspoken service accepts referrals where an individual has experienced at least one traumatic incident at any point in their lives. However, our research has found that around half of those who access the service do so for support for sexual abuse. This includes people who have been abused as a child, as an adult in the community, or whilst in custody, including in prison, in detention centres, borstalls, young offenders institutes, and others. Some men may also be survivors of abuse in care settings such as children's homes or orphanages. So no matter what the traumatic experience you have had, no matter how long ago it was, no matter what your offending history is, Outspoken is there to support you.
One of the most interesting things we found in our study of the Outspoken Talking Therapy service is that if clients do at least 11 sessions, they will start to see improvements in their levels of anxiety, that feeling of being afraid or worried all the time, of depression, that sense of low mood, and the symptoms of post-traumatic stress disorder, which can include flashbacks and nightmares or feelings of hypervigilance. All those things start to reduce when men have attended around 11 sessions, and they will reduce further and consolidate some more for those that manage to do 16 or even 20 sessions. What's also been really heartwarming though is to hear the stories of the men who've undertaken the therapy. What we've heard is that they've learned to manage their emotions better, to sit with their feelings more. Many become very proud of their journey from victim to survivor, and part of that is the space that therapists make for men to realise that they're not to blame for their own victimisation, for the sexual assaults that have been perpetrated against them. And as they make that journey, many men have become very grateful to their therapists, feel that their lives have been transformed, both their perceptions of themselves and their capacity to reach out to other people in relationships that sometimes become a bit fractured along the way as they've had to keep things that have happened to them secret, for example.
Hi, I'm Aisling and I'm the service manager and a therapist for the Outspoken Trauma Therapy service, and I'm employed by We Are Survivors. The Outspoken Trauma Therapy service was commissioned by the NHS in early 2021 to deliver trauma-focused therapy across 15 prison estates in the northwest of England. The service focuses on improving the mental health of male residents dealing with trauma within the prison estates using talking therapy. The service is delivered by We Are Survivors, an organisation which was founded in 2009 to work specifically with men and boys affected by sexual harm across Greater Manchester. The team consists of qualified trauma-informed therapists working through a variety of modalities, We all work through the lens of Judith Herman's model of trauma and recovery. The model is integrative, using a framework for supporting clients to move through a process: stabilisation, processing and integration. Clients are given a choice on whether they attend for up to 10 sessions of Healing Steps, which is our stabilisation only programme, or 20 sessions of Break the Silence, which is our stabilisation, processing and integration. Clients then have a post-therapy session with the therapist on completion. Our referrals come from a variety of different other services around the prison, so we get referrals from the mental health teams, the drug teams, safer custody, on the wing, offender management units, anyone really that's in the prison that has access or is working with or has a conversation with somebody who reports trauma and reports struggling can put a referral in. That referral is then processed by the management team. They're added to the waiting list, and we gain consent from the client. They then sit with the therapist and have an assessment of their needs so that we learn a bit more about them, tell them more about our service, and then after that they're on a waiting list waiting for availability from a therapist, where they then have another conversation in that first session with contractor.